Well, the first question I have for you is, what are some of the subtle signs of age? I mean, we know about wrinkles, we know about sagging skin and, extra skin around the eyes, but what are some of the things that maybe our eyes recognize, but we don't necessarily articulate that kind of gives us away in terms of aging?
Well, you hit it on the nail. Number one, we see wrinkles, lines, fine lines, and so forth. Those are things that when you look at, you're like, oh, that gives away one's age. The skin is really, really important because the eyes, even though you can't tell and I can't tell, the eyes pick up aged skin. So healthy skin is really, really important. And that's where I think in the African American community, they're lucky because the skin stays really healthy and fantastic, whereas in Northern European ancestry and very, very, very white skin, they tend to age faster because they get a lot more photo damage and sun damage, and there's some genetic factors. The thing that no one really looks at but really gives away people's age is the facial shape. And that's something that we don't really talk about and you don't learn in the textbooks. But what that means is when we're youthful, when we're younger, the shape of the face reminds us of like a heart shape. So we have a lot of fullness around here and narrowness here. And your face is perfect. You see, you have very narrow lower face, you have full cheeks, you have full temples. As we age, what happens is this heart-shaped appearance turns into a more rectangular appearance. Things fall narrow here, this cheek pad falls and gets hollowed. And that's where you see a lot of changes. And that's where there's a subtlety that you can't tell, but it shows through. So the shape of the face is very important. And that's why over the past few years, we're focusing more and more on the shape of the face rather than filling in lines and wrinkles. So we use that both in surgery as well as non-surgical procedures with fillers and so forth to recreate a youthful shape. So we're injecting areas like, for example, the temple area where it wasn't traditionally even looked at to give fullness here. We're repositioning the cheeks or giving volume to the cheeks so that the face, again, regains this heart-shaped appearance. And we want to make sure that this area is not very, very full